When my wife Linda and I moved to St. Augustine, we knew we wanted to be involved with the community in meaningful ways that would really make a difference. Linda began volunteering with the Flagler Hospital Auxiliary, and we soon learned more about the hospital's long history of serving our community and its commitment to improving the health of all residents. I knew right away that getting more involved was one way we could make a positive impact.
We were high school sweethearts, college sweethearts, and have been married now 55 years. Douglas was born at Flagler Hospital and has been a patient for 77 years. It's a great hospital to have in St. Augustine.
I unfortunately have been to the emergency room about 3 or 4 times. Everybody that was there was prompt, always wanting to know if there was anything that I needed or they could do for me. I can't think of an emergency room I'd rather go anywhere else.
As the caregiver, I have always, gone right to the hospital with my husband. The last time was probably about 11 or 12 o'clock at night, and he had hit his head. They make sure that we have everything we need there, and they keep us informed as to what test is being run and how soon it'll be before the results are in. The doctors and nurses have been absolutely fabulous.
My son Landon, he was to be born in the month of September, and in late June my water broke early, so we raced to the hospital in the middle of the night. On July 4th, after I think it was about 7 days, I went into labor. He was quite small. He was born 4 pounds 2 ounces. I got a quick glimpse of him. She whisked him away to the Flagler Hospital NICU. My husband would go to the NICU and kind of report back what he was seeing. This was just a little sanctuary, and Landon had his little corner room, and the staff was just amazing. The NICU nurses were his shepherd and his guardian throughout his time there. We don't have extended family nearby, so our lives were really turned upside down. And the fact that we had a NICU right here in St. Augustine was huge for us. He was in the NICU for, I think it was about 3 weeks. We brought him home on July 27th. And he was strong and healthy, and we owe it all to the Flagler Hospital NICU. We have the ultimate gratitude for the NICU staff, the nurses and the doctors. They will forever be part of our lives.
I went to the doctor and I had an irregular EKG. He said there were 4 major blockages. So he asked me if I wanted to schedule, bypass surgery next week. And I said, no, let's do it today. I don't want to think about that a lot. Let's just do it and get it over with. Melody was a trooper the whole time. That's a lot on your mind when your husband, the father of your children, is fixing to go in for major heart surgery. I guess it could have been touch and go. They were right there, and they had done so much that week to take care of me and just help me recover.
I can't imagine going through that anywhere else with another set of people. It was like each person was put there for a specific purpose at a different, point in his recovery. And we're just so thankful for each of those people.
You can call it caregiving all you want, but if you don't care, it shows. Everybody there cared, and it showed.
My name is Robin Cooper. I'm a retired nurse, having worked in the healthcare profession for over 30 years. My husband, Brad, is on the Flagler Healthcare Foundation board. As a nurse and former patient, I understand the extraordinary work the physicians and staff at Flagler Hospital are doing every day. This was the original reason that Brad and I became involved with the foundation. But now, Brad and I know that Flagler Hospital is achieving even more than that. Its vision involves not just healing people when they are sick, but keeping people well and helping all of us create one of the country's healthiest, most vibrant communities.
We all know how important partnerships and collaborations are in our community. I was thrilled to hear of an opportunity for collaboration with St. Gerard's campus, Flagler Hospital, and First Coast Technical College. The young ladies at St. Gerard's campus were interested in expanding their education into the health field. This partnership would better their lives for themselves and for their families.
I went to St. Augustine High School for 2 years, 9th and 10th grade, then got pregnant. Came here, started school, finished in 2016, January. I really like it here. They help both of us. I went to FCTC and I saw the hands-on things, and as soon as I seen it, I wanted to start right then and there. I really appreciate St. Gerard campus a lot. They kind of helped me move forward, and I'm happy.
The people here they provided me support in every corner to try to help me get through this, which was just a blessing. They came in, they provided me with the education on my condition, they provided me with support to help get me through. I actually ended up in the emergency room with type 2 diabetes. Flagler and Wildflower immediately got to me in my room, and everything they provided, there's no way I couldn't succeed. They continue to monitor my condition to see how I'm doing. Currently, this day, I'm under control with my diabetes. It's just been a big blessing to me. I don't know where I'd be without them.
Medicine, I could talk for days about why I want to do it. It's a dynamic field. You're seeing something new every day, new patient, new opportunities. The Pedro Menendez Health Academy program, that really introduced me to medicine for the first time. I was able to follow some great physicians, nurses, to new technologies and science that just blew my mind every day. I'm completing my medical degree at the University of Central Florida. When I heard about the relationship between UCF and Flagler, I jumped on the opportunity to try to see when I could come back to town. And so I was lucky to land a nephrology rotation for 1 month under Dr. Malik. Throughout my experience, I felt more at home here during my time at Flagler and more ingrained in the community because I am a part of this community. This opportunity there really made me reflect on just the culmination of experiences that I've had, starting from that Pedro Menendez Health Academy Institute as a 16-year-old high school student to where I am now, about to graduate medical school and take my career from there.
These are just a few examples of the stories we hear every day about the people whose lives have been helped by Flagler Hospital and by the generous support of all of you. I would like to personally thank you, and I know Flagler Hospital thanks you, and most importantly, our patients and our community thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.